Hey there, I'm going to teach you how to self-assess your hip and lower back pain in just a few minutes. All right, how we do this is we have to think about first, where is the pain? So often you will have pain kind of across the lower back, kind of down into this leg, maybe buttock into this area. It really feels like I should start stretching my hamstring or doing some kind of piriformis stretch. But what happens is if you've tried that and you're not getting any better, here's how you need to assess that situation to get the right movements. Okay, that pain pattern is almost never a muscle problem. It's more likely, or very vast majority of the time, it's a disc problem in the lower back. So very much a joint problem in the lower back that's referring pain out to that area. So think to yourself these couple of baselines. Like, how long have I had this? Is this something that just came on like in the last week, or has this been going on for months? Is it getting consistently better? Is it getting consistently worse? Or am I kind of staying the same? Is the pain that I have constantly there, or is it intermittent? So it's likely that it's more intermittent. It comes and goes with certain positions and postures and activities and movements. So when you think about those movements or activities, what things tend to turn it on or make it worse? What things tend to kind of feel better? Oftentimes, now you have to think for yourself, this is how you're going to self-assess this, but do you feel better with, like, if I'm up, moving around, kind of changing positions, being a little bit active? Am I worse with too much, if I sit for a long time? It's like, ooh, that's really getting sore right through there. If I'm bending, if I'm just standing in one place, like, what things make you worse? You have to think about those because they tend to give you information and a directional preference. In your case, it's most likely where if I stand for too long, if I sit for too long, or if I bend, that makes these things worse. You may even feel an obstruction to movement. So when you've been sitting, driving, working, computer type stuff, when you go to rise, it feels, it's like it's kind of stuck and stiff. And then as you kind of walk it out and you get moving, you feel a little better. Now, it doesn't have to go away, but even just that change in intensity based off of time of day, position, activity, movement tells us a lot about it. So if you feel like there's certain directions, if I'm forward a lot, picking up things, you're gardening, you're working on something in the garage, and that makes you worse, ding, 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 I probably need to go the other way because that makes me worse. So that you have to think about those things in terms of what makes you better and worse when you're self-assessing. All right, so then we would take our baseline. So think about the things we just talked about. What makes you better? What makes you worse? How long have you had it? Is it constant? Is it intermittent? All those things will kind of help us to self-assess. If it's a fairly new problem, or even if it's kind of an older problem, it's been kind of coming and going for months, if you don't have a specific mechanism or reason that you got hurt, you have to think right away, this is probably not a muscle or a tendon or a ligament because I didn't injure myself. I didn't do anything. I didn't pick anything up or fall or have any kind of reason. It just kind of slowly started to get sore. It started here, and then as it went on, it kind of progressed and moved down to this area, and it's gotten a little worse over time. Another key indicator. So next, take your baseline. So at first, we want to know, all right, where is the pain? So take a mental note of how far or where the symptoms are. All right, let's just say it's come through here, kind of into my side of my leg, hamstring, and buttock. All right, then take a pain intensity. So let's just say it's a 5 out of 10 right through this area, and then check your baselines for motion. So your mechanical baselines. So we'd want to stand nice and tall. All right, we want to move the hips over to the side, away from the pain. So close the painful side down. Ooh, what does that do? That kind of increases my pain right here a little bit. As I come back, nope, no worse. That's not wrong. It's just information. Make a note. It increased, and then it's no worse. Okay, go the other way. And remember, it's not a side bend. The shoulders stay square. You're going to slide the hips. Note what you feel. Slide the hips the other way. That doesn't feel quite as bad. That's more of a kind of maybe a stretchiness, but it's not nearly as bad pain that way. And then come back. Then one time forward. What do you feel? Ooh, there's some tension or pulling along here. I can't go as low as I normally would. Sometimes I can go that far. Sometimes I can only go this far. Those are important notes. So just one time forward. What do you feel? Okay, so it was increased, right? I increased the pain when I went forward, but then when I came, maybe I even had to kind of crawl myself back up. Oh, it hurts through the motion. But when I'm back up here, okay, not too bad. Increase, no worse. Just it's a yellow light. It's not wrong to increase that pain. Just make a note of what you felt. And then hands behind you, and you're going to go backwards one time. What do you feel? Oh, that hurts. But where? Where does it hurt? Well, it hurts in my back. It doesn't really hurt down here. It just kind of hurts right here. Okay, interesting. So in general, we want the pain to be up, not further down. Think about how it started for you is pain is kind of up higher, belt line, low back, buttock, and it's kind of moved down over time. So think about, where you feel it as you go backwards. So many times it will feel like it's kind of more here, higher up than it is down, and then the forward will feel more down. But either way, it's okay. Just make a note of where you feel it. Now let's test some things, right? We can't do 10 exercises at once and then see if we're better or worse. There's too many variables. You have to pick just one direction. And you're not going to get this with a single hamstring stretch or a single piriformis stretch or keeping your hips in neutral. Like, well, I'm going to do some planking and some core strengthening. That's not going to affect the lower back. It's just going to be something in neutral. You have to get the spine into end range flexion or end range extension and then note what the results were. What was the cause and effect? Do I feel better or worse afterwards because of doing that thing? So make it into a simple math problem. The X variable is I'm going to bend a bunch of times, and as a result, what happened? Because of X, or because of the bending, how did that affect my X variable? How do I feel now? Am I better or worse? And then we'll go a bunch of times the other direction, right? Backwards. What does that feel like? Is it overall better or overall worse? It doesn't matter as much how it feels during the movement. It's going to hurt probably a little bit while you're doing it. It's the net result after. So first, go to flexion and lying. So you'd lie down. So flexion and lying is a very low level flexion. We're going to go basically, I'll get a little bit of angle here. We're going to go bottom up, so low lumbar up. And so you're going to come this way. I like to cross my ankles, keep the shoulders relaxed, head relaxed. You're just going to pull the knees into the chest so that your butt and hips start to roll up off the table or floor. So pressure on, pressure off. You're not holding it. It's not a stretch. It's a repeated movement. I want to stress that lower back into low-level flexion. So bottom up, pressure on, pressure off. What do you feel while you're doing it? What do you feel directly afterwards? So it can hurt a little more, like, that's probably a 6. Then back to a 5. Or it could be slightly better, right? So here, that's like a 4, 3, feels pretty good right there. I come back out, nope, back to a 6. So decreased, no better, or increased, no worse. If you're kind of on that same line, that's still a yellow light. It's just information. We don't know enough yet. So you got to really test a good 10, 12, 15 repetitions, okay, of flexion and lying. Lots of knees to the chest, unless there's a true red light where the pain starts to actually go further down the leg and remain. If it feels worse while you're doing it and it's staying even when you're back to neutral, then stop. That's not correct. But if it's just, kind of hurts a little bit, and then, no, it's the same 5. Or, it kind of feels pretty good, and then, no, it's about the same. You got to get enough reps. So once you've gotten a bunch of reps into flexion and lying, then stand. Think to yourself, okay, how am I different? Again, those baselines. Where's the pain location? Well, it's the same spot. How is the intensity? Still a 5. And then how are my motion? Okay, that feels about the same as last time. Maybe I can go a little further. How does this other one feel, right? Okay, maybe I can go a little further. How does this one feel? A little bit pinchier, higher up, and then that way. So what you're looking for are changes in the baselines. If the pain location is closer to the lower back, right? If it's up higher, green light, keep going with that one. If it's further down, then stop and we'll go to the other one, okay? So rethink to yourself, okay, that pain is still about the same. In this scenario, let's say that after I did 10 to 15 of those, everything's about the same. Go back and do it again. You need more information. It's not enough. It hasn't changed for better or worse. It's just about the same. Nothing is really that much different in your motions. A different scenario would be this. I did 10, I did 20, I did 30. Now my leg is actually a little bit worse. I feel it a little bit more intense. It's starting to move a little bit lower into the calf. I feel a little bit more obstructed. I can't quite go as far to the side that way. I definitely feel more stuck this way. I can't get going that way, and it's really hurting. And then I feel a little bit stuck. Okay, now that would be a red light. Now you've assessed yourself and you realized, you've got a conclusion at least, that flexion is wrong, that you're flexion intolerant. You're not allowed to use that one right now. It's just wrong for you right now. So we're going to go the other way. In a different scenario, right, 10, 20, 30, 40 reps, you're like, man, that feels pretty good. I've got improved. It's smoother with my motion this way. It's smoother with my motion this way and this way. The pain has moved from here to here. It's further up. It's not as sore. Green light. Keep going. 50, 60, 70, 80. You need lots of reps. You can't just go like 2 sets of 10 and call it a day. You need lots of reps if it's making it better overall, okay? So, in recap, okay? If it's the same, no better, no worse, keep going. If it's slightly worse, and worse means further down, loss of motion, or pain is increased, and it's remaining. Like if it's slightly increased, and then you're no worse after 30 seconds, it's calmed back down, that's not worse. It's got to remain like, this thing is sore, and it's that way for minutes afterwards. Then that's a red light, we got to switch. All right, if it's better, the third scenario, my pain is less, the location is improved, and my mechanics are improved, keep going. So in this scenario, to self-assess even further, let's say that the pain is overall worse, okay? You've tried this, the flexion in line, and you're like, no, it's not doing it. Like I feel a little bit more pain, it's a little bit further down. Or in another scenario, you've tried the flexion for days, 24, 48 hours, 72 hours, and it's just no different. It's like, it has not helped me at all. Then it's time to switch directions as well. But so it's one of the two things. Either I've tried the first one and I'm not making any gains, okay, then switch. Or I tried it and it's pretty quickly made things a little bit worse, then go the other way, all right? So the other way would be extension in line. Then what we're gonna do is we're gonna lie face down and we're gonna come all the way flat, okay? Monitor again your symptoms. Hands low under your shoulders, hips relaxed. Press up, press up, press up, press up. Ouch, that hurts my back in the right. I don't like that. Okay, come back down. Don't hang there. It's not a stretch. Remember, this is not a sustained thing. It's a pressure on, pressure off. Okay, stay relaxed. Whew, okay, pain calm back down to 5. Okay, come up. Ooh, 6, 7 in my back, buttock. It's deep. It's stabbing in my butt and leg. Okay, back down. Okay, back to a 5. That's not worse. That's not a reason to stop. So keep going, okay, as long as it calms down quickly, legs relaxed. So you're just going to go the same thing or the same number of reps that you did with the flexion, just pressure on, pressure off. Every rep, try to get just a little bit higher. I know the first couple might be here for you, but as you get looser, just go higher and higher, further and further, further and further till you can get the elbows locked. Okay, then breathe out. Ouch, big pinch, come back down. All right, keep going till you get about 10 to 12 to 15 reps, okay? Then you're going to come back up and you're going to reassess those baselines one more time. Like, okay, how easy did I rise? Was it smoother to rise up? Was it more difficult or kind of more sticky? And then baselines. Where's the pain? It was here. Now it's more sore like in my buttock or lower back. Okay, moving up is a good thing, okay? Check mark on the box. That's a slight green light. How's the intensity? Well, it's probably a little bit more intense. It was a 5 here. Now it's like a 4 here and a 6 here. That's a tricky one because it's slightly increased, but it's increased more centrally toward the spine or the lower back. That's actually still a green light or a good thing. Check box, okay? We want it to feel like it's pulling and moving the pain out of that leg. You know, the spot where you're like, damn, I just can't get that thing to stretch out. I try all these stretches and it's not moving. But now all of a sudden I do that and it's like it's starting to move and change. So keep that in mind. And then 3, mechanics. So how did I move left? How did I move right? Okay, this one, yeah, that's a little smoother. It's not quite as pinchy. And then how do I go forward? It's a little easier. I can get a little bit further. Oh, it still hurts, but I can go a little bit further. I come back up and then test the backwards, and that's still pretty good that way. So in summary, that's how you're going to self-assess this. 1, you're going to check those baselines and think to yourself about the situation, your history. Forget about the MRIs and the x-rays and all the things that's information, but it's not as important as what you feel. You know what makes you feel better and worse. You know you've got a problem there because you can feel it. So whether the x-ray or the MRI looked good or looked bad, or they're saying, hey, you've got this problem, you've got some kind of hip bursitis, it's not that. It's not piriformis, it's not hip bursitis, it's not a impingement, it's something in the lower back, in the spine, probably disc related between that joint. And how we're going to prove that and test that is these motions, right? Flexion in line and or extension in line. So test those out. Make sure you pick one to begin with and really test it. 10, 20, 30, 40 reps. The results of how you feel after doing that will tell you whether you should continue on, it's improving, or no, that's not improving, I don't like, or you need to switch to the other one. But that's the best way for you to do that at home without giving you a packet of 10 exercises and saying, hey, good luck, which is what a lot of places are going to do. You're going to go to a place, they're going to give you, 10 of these and knees side to side and bridges and all kinds of stuff, where then if you're a little bit worse, you'll have no idea why, because you didn't even know which one. There was 5 to 10 things on the sheet. I have no idea. Now you'll know, because you're testing one thing at a time and you're relating it back to your baselines. Can I sit longer? Can I stand longer? Can I walk farther? Am I better in the morning when I first get up? Am I worse in the morning? Is the pain worse when I'm sitting? Those things will give you information on, that was not correct for me, or it was correct. So I would start there and then let me know what things are changing.